Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning into the latest edition of the Checkup. For several years now, leaders across the industry have talked about the need to address health beyond the four walls of the hospital. And that's taking shape by looking at such things as community health and well-being, and as we know, social determinants of health. In April 2020, Adventist Health made a big push in this area when it acquired Blue Zones, a not for profit that spent the last decade looking at ways to transform care delivery. I'm pleased to be joined today by Ben Leedle. He's president of Adventist's Wellbeing Division, which launched in October of last year, and he's also CEO of Blue Zones. Ben, thank you so much for being with us today.
Glad to be here, Matthew.
So let's start at the sort of beginning. If you could give folks who may not be familiar with it sort of a brief background on Blue Zones. You've been around for, as I said, a couple of decades now, doing some really transformative work within and outside of the healthcare industry.
Sure. Blue Zones is a company that works on transformations for whole communities and for organizations by helping to bring in 9 secrets of longevity and happiness that were discovered by its founder and National Geographic Fellow, Dan Buettner. And he was supported with a science team, National Institute on Aging, and sent around the world to find the non-genetic related places where people live the longest, the best. And from that work, he wrote several best-selling books, and the contents of that evidence base have been used to create a reverse engineering for our American communities to try to increase what has been a trending effect on both the growth in disease and the shortening of our lives here.
And so when we think about concepts like that, and you think about what it means to a system, a large system like Adventist Health, how does that kind of union come together? Because again, as you know, health systems have been trying to address some of this stuff in patchwork for a while, but how does that kind of union come together?
It's really interesting what's taken place, particularly over the last 10 or 12 years with this work. Not-for-profit health systems under the Affordable Care Act are obviously required under their tax status to contribute back to the communities that they're serving beyond the traditional acute care scope of work, which means trying to find the right way to invest those dollars into a meaningful way to lift the health and well-being of all the citizens in their markets. And there's been a lot of formal work done and advancement around the community health needs assessment work, which basically is getting better and better at pointing out the problems that we face, but that there was difficulty because traditionally hospitals and clinics were not set up to with mechanisms or infrastructure to go pursue creating this type of change. And so Blue Zones has become a strong partner to the health system care provider world in partnership for the work around community benefit. But as these partnerships have evolved, I think the providers have seen against maybe some of their early fears that there would be destruction for the demand that drives their core businesses by a program that reduces disease, that the relationships that they built with their community, the acknowledgement of their brand being credited for doing work in health prevention and well-being has helped build the consumer loyalty for them. And in an age where growth is difficult, particularly organic growth, because all the volume forecasts are reflecting that you're going to need to hold on to your share and perhaps steal share to be successful. And so it's been a program that has resonated at a business level and at a mission level, and even at the technicalities of a tax status protection level for these health systems.
Yeah, I mean that community needs assessment piece that you referenced from the Affordable Care Act has been one of those challenges, I think, for the industry. Right, everybody's required to go and do it, but sort of as you're alluding to, the payment system, the way the delivery system is set up, it's not really geared still towards addressing some of those things that they may unearth in a community needs assessment.
That's true, and even when those community health needs assessments are really strong. Taking action is proven to be the biggest challenge. So if you think about when the Affordable Care Act went into play, and that these needs assessments are done and identified, formally every 3 years or so, we're on fourth generation needs assessment, and really the broader market struggling to assure that they're investing back enough, and when they do, that they're going to have a model that can be accountable for the impact that's being promised.
So let's talk a little bit, if we can, Ben, about sort of how you've integrated Blue Zones then into Adventist. As I said, you're now heading up Adventist's new well-being division. You're still running Blue Zones. What are some of the integration opportunities and challenges you faced over the past less than a year, I guess, since the acquisition was made?
Sure. And so we're doing work, obviously, for Adventist Health in their footprint. And Adventist Health has made a bold commitment to its communities, expecting to invest $1 billion over the next 10 years through community benefit, gifts, grants, and partnerships. And even though that resourcing is there, the real hard lift is working with the existing business and infrastructure of hospitals and clinics in order to collaborate and build coalitions, because this is not work that you do to a community. It's a body of work that you empower a community to do for itself. We're bringing experts, we're bringing tools, we're bringing process, we're bringing funding and resources. But it's the biggest challenge is that it's awkward at best for most providers to step out into the community and do this work. So we're in the phase of rolling out 6 communities concurrently across a footprint that'll grow to 25 over the next 3 years. And I think the early work is putting in the relationship and governance structure with a community, and then allowing this to be a primary part of the work that the hospitals and clinics will do in concert with Blue Zones. So it's probably not a surprise to you. Culturally, it's a big shift. And experience-wise, we're exercising new muscles as a health system to get outside, as you said, the 4 walls, and at a grassroots level, begin to create the change that these communities need.
So, what is that sort of elevator pitch you make when you go into these 6 and growing communities to the executives and the boards of those hospitals, to get them to understand that they might lose some revenue on the front end, but overall, this is a good idea. It's part of the mission, but it's also a good idea for the health of the community. What's that conversation like? What works? What resonates?
What resonates are 2 levels. So there's a mission conversation, and Adventist Health is living God's love by inspiring health, wholeness, and hope. Well, that is well-being, and yes, you can do that through medical care provision, but the companion to that, all that love poured into the patient gets diluted if they're going back into a life setting that is working against all of those measures of effort. And so part of this is just this is our mission. It's not just our purpose. We have an obligation, and that always resonates. The business case moves from a qualitative construct to a quantitative one. So for each of these communities, we do quite a bit of detailed analysis using simulation models to be able to take in all the forces that create value, those that could destroy value, and then share what we think that looks like as an impact from the program. So those foundation boards of Adventist Health, the board, community boards, system board, the leadership at the hospital and the clinics are all looking at the same business case that's sitting next to their mission, and that's a process. It takes time. So we're spending anywhere from 3, 6, 9 months building out those cases on a market specific basis, and then going to the broader community with a community case. Oftentimes needing to be able to be understood across the public sector and the private sector. So These are fairly sophisticated developments, and they take some ground time to get installed.
Yeah, not just a plug and play,
That's
obviously.
right.
How do you identify? You said you're starting with those six, and then you're going to build from there. How do you identify the communities that are well suited to start this kind of work?
That's a great question. We have, over the last 12 years, built an underwriting process. Don't need to think of that in an actuarial sense, but in a sense of what's the likelihood that if the resources were brought, that there would be leadership across community sectors. So the public-private sector, the private sector, not only the healthcare industry leaders, but business in general, and the not-for-profit organizations in a community. So a readiness among the leadership, a test for willingness to stack hands around a common approach. And then we do ask the scientists to do quite a bit of work using the Gallup database on well-being, where we're actually looking historically and current state, and then asking the scientists to project if nothing different is done, what does that cost of doing nothing mean for this community in terms of medical cost, lost productivity, economic vitality, jobs, real estate value. So it's a very wholesome simulation, and then we forecast what we would expect a Blue Zone project to create as a positive impact on that forecast. So there's a qualitative, quantitative side for the community as well.
And how long does it normally, given your experience with blue zones, obviously outside of Adventist, how long does it take for you to start to see some measurable results?
You see some process measures fairly early, particularly around a groundswell of citizen or consumer awareness and engagement. With the engagement, we have the chance to be able to parallel and put in implementations across policy and a lot of place-based work. And what that yields is the beginning of people being exposed to things that will create healthy choices being the easiest choice, if not the absolute default, in most of the places and spaces where they're spending their time. For adults, maybe the workplace; for kids, schools, but also restaurants, grocery stores, faith-based organizations, and even encouraging citizens to take pledges to do things in their own home that align to Blue Zones and the Power 9 principles. By year 2 of these projects, we begin to see risk reduction of a dozen really key risks that we know feed into the development of chronic disease. And by years 3, 4, and 5, we begin to see the ability of that risk reduction translating into medical cost reduction, workforce productivity, and even begin to look at measures, the early measures around broad-based community metrics that have been important measures for the community long term. So by the time you're 3 to 5 years out, you can begin to bring the results back against the investment. Typically, these projects will hit a run rate break even by 2 years, and cumulatively pay back the investment 3 years into the work. And by 5 years, you're seeing solid 2, 3, 4 to 1 ROIs as it relates to the investment.
Well, interesting. Great to sort of see that timeline. I appreciate that.
Yeah.
Lastly, Ben, and this might be a little bit outside of your realm, but given everything we've seen over the past year and a half through the pandemic, vaccine hesitancy, distrust from certain populations of the medical community, the ongoing problems with the politicalization of the COVID-19 situation and vaccinations, are there things that you've done through Blue Zones that you think would be applicable now to sort of build back some of that trust in communities and the medical community and healthcare?
Yeah, I do. And in fact, our experience through the pandemic, as you can imagine, Blue Zones is a model that was based on convening much of that in person. And we were challenged to build essentially what we think of as the digital twin and being able to do things virtual. And we actually expanded several Blue Zone projects that were existing and have added others during this pandemic. And I think, we think of it as this side, hopefully, of the pandemic, that local leaders are looking for a definitive way to respond, and Blue Zones has resonated as a step to take, because if you look at the data, which you're familiar with, people of lower health and well-being were the most susceptible and most impacted by the pandemic, and Blue Zones works to build resiliency. So not only do you get a formative way to respond as a community and as leaders, you have the mechanism by which you're responding with building resiliency. And then we know that Blue Zones has lifted local economies as a function of its efforts. So you think of recovery, but more than anything else, maybe to the point of readiness. The one thing Blue Zone Project does brings collective decision making back for a community, which somewhere in the last 30, 40, 50 years, American communities kind of lost that ability to convene themselves in order to do what they think is best overall for their communities. And if you think about the ability to respond quickly, to be able to push initiatives broadly across the whole citizenship, Blue Zones Project creates an infrastructure and a governance structure for being able to do that. So we have seen a growth in the demand and interest of the work that we're doing through the pandemic, and in particularly a sharp increase over the last 6 months, as I think people are feeling a need to get ready. We had some observational research done during the pandemic that compared our Blue Zone projects that had been in place for greater than 3 years to matched and like type communities, and across every dimension and measure of the pandemic, those Blue Zone project communities performed much, much better. And so while that's not the end of trying to understand the impact, it begins to show a light that while it wasn't developed for a pandemic, it seems to hold up really well as a companion to a community to stay healthy.
Got it. Well, we appreciate those insights. And Ben, we appreciate your time. We know you're extremely busy, so we appreciate your
It's
time. And we'd love
exciting
to
to
stay in touch as Adventist rolls this out over the next, year, next 2, 3 years. We'd love to see some of the results and talk to you more about that in the future.
Would love to come back and share those results.
Great. Thank you so much.
Thank you.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of the Checkup.